Hi guys, welcome back to the channel. Infertility Awareness Week is around the corner, and I thought I would bring a psychologist to come on board and tell us about, what are the needs of those who are going through infertility or those who are going through delayed conception. So please keep watching. Hi Jennifer, welcome to the channel.
Thank you, Lisa, for hosting me.
It's good to have you. Now, lots of people, when we're talking about infertility, are talking about the causes and all these things, but we never think about the mental toll that it takes on us. Now, I'm so happy that you're a psychologist and you've come on here on the channel. Just introduce yourself and then we'll get to talk about more about that mental load that it takes on women.
Okay, thank you so much, Lisa. My name is Jennifer Malé. I'm a clinical psychologist attached to infertility here at Neogenesis Fertility Center. The journey and my understanding of the mental health toll has sort of a personal predisposition. In 2021, I had a baby, but before it was a very difficult situation. A very difficult pregnancy. I stopped working at 12 weeks.
Wow. Oh,
yeah.
no.
And I had to stop working. I told my employer I can't hold it up. My doctor said the best way you can with this sort of situation is for you to be at home. And I can't tell how long you will be at home. So I was home, maintained on hormones. I had to do plenty of rest. I kept on praying 1 week, 2 weeks. I had to be home. Yeah. And then as I was recovering from that at 26 weeks, then COVID hit me. I had the severe type, and I went through depression, anxiety, and all of that. But as a psychologist, I was pulling myself out, talking to myself, doing all these sorts of coping skills. And then I kept on thinking, what about those that don't have the knowledge that I have?
If the expert,
exactly,
you're going through this,
then what about the mothers that don't have the support or do not know the things that I know? That was one. So I began talking to fellow doctors and medical people about the need for us to incorporate that psychosocial support for women that are expecting. So that was the first concept I wrote as a clinical psychologist. But the backdrop is that I come from a medical background and I'm a public health specialist as well. So I wanted to connect and link the two. That what is needed. Is it information? We should have that information about the signs and the symptoms, but even what to do when you're going through a depression or an anxiety during your pregnancy. But when I researched deeper into the topic, I actually realized that mental health starts from the womb. Yes.
How is that? Because I'm not yet quite convinced.
So the psychological state of the mother has an impact on the child. So if you're depressed, you have anxiety, or you're going through some psychological stresses, the child will have an effect because of
what you're going through.
Yes. And you notice that for us to be mentally well, the mother has to be well during that time of pregnancy. So I started building that concept around there. And there's what we call also the biopsychosocial model of looking at health.
Okay.
Biological meaning that your physical health, your hormones, your blood, your build up, how it is, will affect you. So that is the direction that the doctors will be looking at. You understand, in most cases when you come, we check on all those things.
Check on just the body, etc.
Exactly. But most cases we miss out on that psychological aspect. How are you psychologically? How is your mental health? How are you coping in this situation?
Because pregnancy takes a toll on us.
Exactly. How is your esteem with this? So that is the psychological. But then the social bit. Do you have social support? What is your socio-economic status? How is society receiving you with being pregnant or not being pregnant? So the biopsychosocial approach looks at this whole person approach to fertility. Yeah.
All right. So when you are doing that kind of research, you mentioned you realized that if pregnant women can go through that mental load, how about those who are trying to have children and are failing?
Yes.
And that's what we want to focus on today.
Yeah.
Infertility is such a huge, sensitive topic.
Yes.
And I just want to know from your experience working at Neogenesis and working with patients, how many people do you see that going through infertility and going through mental difficulties?
Yes, the mental toll is very, very real. I would say in terms of depression, 3 in 4 patients will have depression, ranging from moderate to severe depression. And you know, the psychological toll happens at different phases. We have before. Before you come for fertility, you could be going through something. But even during, you know, is this thing going to work or it's not going to work? Then afterwards, is it successful or not successful? So those aspects, you know, but before you could come with childhood trauma, you could come with depression, you understand? So if we just begin the routine treatment without looking at you, we might miss the point. You get it? You could be going through grief. You've lost a baby and now you want to try again. So how do you treat a grieving patient in infertility? You understand? And I'm noticing that there's something that we have missed in the medical. A miscarriage. Someone has a miscarriage and it is business as usual.
Like,
it is
move on.
It is not business as usual. It is, you have to go through that grieving process. You know, the stages of grief are real. People go through depression. People lose their sense of self after a miscarriage. So we need to look at you. Who are you when you're coming? What is your mental health status before we start the treatment on you? That is 1. 2, as we do the treatment, anxiety builds up. You know, will this thing work? Will it not work? Am I responding to the treatment? Am I not responding to the treatment? But then there's also the social stress of money, you know, the finances. These treatments are not cheap. They're very expensive. So there's a lot that comes into play and must be managed. Around that time, we try to give you coping skills, how to live in the moment. You understand? Without thinking so much about your expectations, but, you know, just carry through.
So you've mentioned all these things. Is this something that Neogenesis does? Like, if I have an issue, fertility, how do you approach it at Neogenesis?
Thank you so much. What we've done here is to develop a whole person approach that looks into your biological, but also the psychosocial dimensions. We have a model whereby when you come in to see the doctor, you're not only getting assessed for your infertility issues, but at the doctor's end, he's also reading into the psychological bits. So in most cases, he will then inform me that I'm sending also this patient over to you for assessment. And it has helped so many patients. Some of them we can't even continue. Dr. Muyingo can't continue with the treatment without maybe being treated for depression or anxiety.
Really?
Yes. There have been those cases where he's like, no, let us first manage the depression and then we can continue with the fertility.
That's really good to hear, because no one ever talks about this. We are only focused on getting the baby, but we don't think about what the toll that this person has been going through, their mind, and how it can actually affect. Now, what have you seen as some of the biggest concerns when people come here?
Thank you so much. We have the social concern because, you know, from when we are children as women, we are nurtured into being mothers. You were expected to have a baby at one point. So that there's that social expectation of a woman to have a baby. So when you don't have, then it is a concern, which will bring a bit of stigma, social stigma, but also self-stigma. Of I have not been able to meet the societal expectations. That's 1. Number 2, we have the relationship concerns. As you and your partner get into a marriage, you expect that maybe we shall have this number of children, and it's not happening.
After 1 year, I want...
Exactly. So the expectations have not been met. So the relationship, if it is built around children and that meaning of life and that view of life, you're going to get into a depression or a mental health trouble. Then the other thing has been the sexual concern. When you're depressed, I mean, you can't function in that area because it's a hormonal process. For you to get excited, you have to be happy. You understand? So the sexual concern is also there, but also the need for parenthood. You know, at one point you want to have children and it is not happening to you. But then now the rejection comes in. You become a social misfit. People begin to brand you as a witch, as a failure because you don't have children. So those 5 dimensions come in handy.
And that's what you help people, you journey with them.
Yes, I journey with them because the depression will come from this event and how you interpret it in terms of your thoughts. You know, when those pressures and those concerns press you hard, you're going to have a certain way of thinking about life, which will affect how you feel, either sad or with a depressed mood, or as a person who has feeling disappointed or feeling anxious. And on the other end, your behavior now, you either begin to withdraw and isolate, or you begin to cry all the time because of not having a baby. But now, interestingly, your body responds to that process because they're all wired.
They're all working together.
The thoughts, the feelings, and the behavior are going to affect your body. You see your heart rate going up. Hormones, you know, will be affected. That's why doctor will tell people first go through this sort of therapy or psychological intervention to get you right so that we can treat you.
Treatment. So I also just want to ask, I know Neogenesis has avenues to help people who are going through infertility, but what have you experienced when people are going through treatment? Does it affect them as well mentally?
It does.
How does it do that?
Actually, from my observation, 3 out of 4 will have depression, a form of depression.
3 out of 4 going through the treatment.
Exactly. Ranging from moderate depression to severe depression. Those are the cases that we see. That is, I told you about the cycles of the before, during, and after. That is before. But during, anxiety now begins to build up. You check somebody and their levels of anxiety are high because they don't know whether it's going to work or not. Then after, for those that have had negative results, there's a grief process. And if we don't manage it, you can end up into a severe depression, which can lead to a suicide. Because somebody's like, now that I don't have a child,
what
and
am
I'm
I
a
going to
social
do?
misfit, let me end.
So I would like to know, what sort of advice would you give someone out there who's going through infertility or is on the journey to make sure that they're in the right state of mind?
Number 1, you must have hope. You must not lose hope that it's a hopeless situation, that I can't live without a child. There's more to life.
That's a hard one to
It's a hard one, but when you come to therapy, we help you to adjust, to find meaning in life. Because even children want to find a mother or a father who has meaning to life, because that's what you transfer to them. It's not just about having children, but what kind of person are you?
Find yourself.
Number 2, you need to seek for expert assistance, because you could be depressed because you think there's no way out. But when you come here, and
there are solutions.
There's solutions to it, and there are various solutions. You know, from surrogacy to
IVF,
donor, IVF, IUI, a lot of things can be done for you. But then also self-care. Taking care of yourself, refueling and refilling yourself in meaningful ways. What are you doing towards your own health? You know, how are you coping? Are you negatively coping or positively coping? Negative coping would be you beating yourself around with it, you involving yourself in destructive behavior, like drinking, smoking, drug and substance abuse, because of what you're going through, to numb the pain. That is negative coping. But what positive coping is for you to engage in good nutrition, exercising, listening to positive messages, positive thinking, The other thing that you could do is to have very good social support.
Yeah. I was actually going to ask, how can people support those going through that
Exactly.
situation? Like,
Yes.
how can we support our sisters, our friends going through that?
Yes, through sharing how you feel. Exactly. So social support is having a group of people that you can talk to and turn to, and they're willing to listen to you and to understand what you're going through.
Yeah.
Because what brings the building up of depression is you not having social support, having people that you talk to, having people that can listen to you and understand and interpret and help you refine how you know, when you're alone, you can be there thinking, oh,
your
now
mind goes places, the
now
worst things.
I'm finished. I'll never be anything without a child. But when you go out there and you talk to someone, no, but there's another way of living. Actually, you can be a mother in these other ways. You can be meaningful in life in these other ways. You have these talents that the world needs. So you channel that energy elsewhere as you come for solutions.
Medical solutions.
Where we are here at Neogenesis.
All right, Jennifer, you mentioned something about solutions and, asking an expert, coming for therapy.
Yeah.
People have a fear.
Yes.
Of therapists.
Yes.
Sometimes we think that if we see a therapist, that means we are mad.
Yeah.
We have lost it and things like that. There's also the perspective of adding in the faith.
Yes.
So if I come for therapy, what does that mean in terms of my faith? I'm not having faith enough. Am I, like, what is going on? What can you say about that?
What I can say about that's a beautiful question, because man is in body, soul, and spirit. So the spirit is what connects to God. The soul is where we have the mind, the will, and the emotions. And for us in therapy, we look so much at the mind and the emotions and getting your will in the right place. And the body is the mirror that you see.
Yeah.
But if you're to look at this entire system, the soul arena is what is in the middle. That is what connects us to the spirit. That is what connects the spirit and the body. So if it is not in the right place, it means that even your spirituality could be
affected.
Yeah. You're not connecting well. So we treat the mind so that your spirit can connect to that. Yeah. So if you're wounded in your heart, maybe you have trauma.
Yeah.
You have this negative worldview. You understand that can affect your spirituality and also affect the way you relate with the world in the physical. So if God, say, has called you to be a giver to a certain group of people, and in your life you had been traumatized by those people, and you have not dealt with that trauma, in the physical, it becomes hard for you to function in that. So what therapy does is that it helps you to reconcile with your past, to accept yourself, to build yourself, to increase your self-awareness, but also treat your thoughts.
You guys, so please, therapy is not a problem. You need to see someone, and I'm glad that Neogenesis has a wholesome treatment. It's not just treating the body, but you're treating the mind as well, and that is very key, because like you've mentioned, if your mind is not in the right space, even the treatment you're doing may not work.
Yeah, it may not work. Yeah, because the entire mental health is not just about the head. It's the entire system. The neurotransmitters, the hormones, your blood, your gut, your energy, and also your surroundings. They are all connected. Yeah, there's that connected. And your spirituality.
Yeah.
So everything is connected. So we want to look at you as a whole.
As a whole person.
Yeah, so that when you live here, you have your healing in all sorts of dimensions.
Yeah. There's a couple out there. They are married and they are struggling.
Yes.
What would you tell them in that season?
Yeah, that season is not an easy one. But what is most important is not to stress each other, to begin to point blame, to criticize, to judge, to condemn. What is most important is for you to come out and get an expert opinion on what the problem is. Find what the problem is number one. Two, what are the solutions? Because when we are here in this sort of clinic, we offer you all these things, and you get to know, okay, do we, if If it is the womb, the doctors will help you build up your womb. If it is hormones, there's a hormonal replacement therapy. If it is a mental health issue and you're not connecting, we help you also to connect as a couple so that you can have a meaningful life.
That's amazing. And we've talked about those going through it, what they can do. We've talked about the married couples. What about us, the people, the surrounding, you know, those people surrounding those guys going through it? What are the things we need to say? How can we support them?
Compassion. I'll say it like 1,000 times. We should not be judgmental. We should not point fingers. We should not ostracize people. We should not stigmatize women that are going through delayed conception. You know, we should try to encourage them to seek for solutions. Especially now, technology is here. They can come, and there's so many alternatives.
Thank you so much, Jennifer. Guys, Neogenesis is the place you need to go. It's located at Bukoto Street. Please come check. Have an expert, you know, check you out. Have a therapist, you know, go through the mind healing before you actually even start the treatment. There are lots of solutions, and we know that we are co-creators with God. So we are also working with God in the process to bring forth life. So don't feel like if you come here, that means you don't have faith. No, it means you're just working with God to make these things happen. Any last tips you want to share with the people out there?
I would love to encourage you all to connect with other people. Human life is about connection. Connecting to your peers, connecting to your families, connecting to your surroundings, to your environment. And let us heal together. Let's not stigmatize people. Let us not become stressors of sorts. Let us love one another, and we'll see you around.
All right. Thank you so much for being here. Guys, this is just the start of the segment. We have talked about the psychological, you know, needs that people are going through. What treatment can we offer at Neogenesis, or what are the causes of infertility? We want to make sure that we're giving you wholesome information. My name is Lisa Kusima. Let me know in the comment section, what would you like us to talk about? You know, if you're going through this, what advice would you want your sisters, your friends to know and to support you on this journey? I am here to